Attention Deficit Hyperactive Disorder, better known as ADHD, is a neurological disorder that can affect kids, teens, and adults. ADHD can affect someone's ability to concentrate on work or be very impulsive. This can lead to trouble with social interactions or carelessness while working on a project. It is also estimated that someone with it will have a shorter life, approximately by 13 years. ADHD is most commonly caused from genes, but it is possible to get it if one has a significant head injury, is born prematurely, or is exposed to alcohol or nicotine. In the brain of someone with ADHD, there are 4 parts that have been found to be smaller than the average brains. A part like the frontal cortex, which controls things like attention span and organization, are smaller. There's also the limbic system, which controls emotions, the basal ganglia, which affects communication, and the reticular activating system, which controls impulses. There are also deficiencies in some neurotransmitters. For instance, there are dopamine and serotonin, which can affect someone's mood and sleep. These deficiencies can cause anxiety and hyperactivity, like we would see in someone with ADHD. Due to the brain structure being less developed than that of a usual brain, the lack of neurotransmitter can lead to problems in neuron communication. Besides the releasing neuron creating less neurotransmitters, the receiving one will also have more difficulty grabbing onto them. There is also the possibility that the releasing neuron will suck back in neurotransmitters before the next neuron can make a strong connection. ADHD is usually detected between the ages of 6 and 11. The earlier it is detected, the more severe the ADHD will be. It affects both males and females, but men are 3 times more likely to get it. Approximately 5% of the world's population has ADHD, including 6.4 million kids just in the US. Symptoms of ADHD are usually less prevalent in adults, but they will still feel the effects of it. Some common symptoms are impulsiveness, disorganization, restlessness, trouble prioritizing, and inability to complete tasks. In adults, this can be things like losing glasses or having anxiety. In children, it can be something like having temper tantrums or not paying attention during class. There are many tests for ADHD. An EEG will analyze electrical activity in the brain, as well as compare it to other neurological disorders. There is TOVA, which is a computer-based test that will give information about someone's attention span, impulse control, and reaction time. There is also the Conners-Ring scale, which assesses common ADHD symptoms. Possible treatment for ADHD can be medication or therapy. The most commonly prescribed medication are central nervous system stimulants. The different medications have different effects, so ask the doctor which will work best for you. Something like Adderall is amphetamine-based, while Ritalin is methylphenidate-based. While stimulants may help, there are obviously going to be side effects. With methylphenidate, it can cause mood changes, insomnia, and anxiety. There is also the possibility of drug abuse, in which case you should stop medication and get help from a doctor. The patient is 7-year-old Billy, who lives in Kentucky with his parents and older sister. His mother is Hispanic, and his father was raised in the United States. His father was diagnosed with ADHD at the age of 10. Due to Billy being left-handed and his seeming lack of care for schoolwork, it is often messy. His uncle, who is a smoker, visits them every summer. In his free time, Billy likes to play outside, but usually just with his sister because he has trouble making friends. Around a year ago, Billy's parents began to take notice of how he talked over people during dinner or while meeting other people. He has also never seemed to do anything they told him. For instance, when he was told to clean his room, he would start cleaning but never finish. He often had mood swings, and when he was angry, would have tantrums. His parents thought this was unusual behavior, especially for his age, so they brought him to a clinic to do a neurological evaluation. Once his parents explained the situation, Billy was given a Conners CBRS assessment, along with his parents and a teacher. The scores of all 3 tests were added up. Billy's T-score was 62, which indicates moderately severe issues. Not only was he having trouble sitting still for the duration of the test, but his answers also seemed to indicate ADHD. Just to make sure he is not misdiagnosed, the plan is to do an EEG test to rule out any other possible neurological disorders, for instance, bipolar disorder. Once we are confident that he has ADHD, he would probably start with therapy. We will first meet to ask about allergies or anything health related before prescribing any stimulants. That being said, if all goes well, he would probably start with Adderall to hopefully create more neurotransmitters in his brain.